Hello there and welcome to another episode of the interview. Today, I'm so delighted to have Mary L. Blankson, that will be sharing with us about, COVID-19, which is something that, is a global pandemic, and there are all kinds of things going on. So I thought of, bringing a medical professional to talk about this so that we can benefit from it. So I will encourage you, as I always do, to ask relevant questions, and so that Mary will be able to respond to them. So I will go ahead and introduce her, and after that we'll start the discussion proper. Today I'm delighted to have Mary L. Blankson, who trained as a nurse, obtaining an MSc in nursing at Yale University and a doctorate in nursing from Johns Hopkins University. She has served in different capacities, caring for the undeserved populations throughout Connecticut. Mary currently serves as the nurse executive supervising the work of nurses and medical assistants in the clinics of one of Connecticut's largest federally qualified health centers. I'm so delighted to have you join the program today, Mary.
Thanks so much, Seth.
Thank you so much. All right, so I will start by talking about, we are basically talking about, COVID-19. Mm-hmm. There have been a lot of information, and I would say misinformation about COVID-19 since the break of the pandemic over a year ago. So my first question to you is, let me start by asking you something that is somewhat silly, but I think obvious about COVID-19. Is COVID-19 real?
Absolutely. And I've seen it with patients. I've processed lab results. Even my husband, had a patient who passed away due to COVID-19 and had to say goodbye to her, via video chat. And, he's an advocate for adults with psychiatric disabilities, and she went into the hospital with COVID-19 and ended up dying from that. And certainly just the amount of effects that we've seen across our communities, across Connecticut, across the U.S., and certainly across the world, it absolutely, it is real, and it is wreaking havoc no matter where you are.
And as a medical practitioner, I guess you have started talking about that. You have been at the forefront of dealing with patients and caregivers since the outbreak of this pandemic. Do you mind sharing, some of your firsthand experiences?
Sure, absolutely. So just so that everyone is aware, I'm a family nurse practitioner, and so I practice in primary care. And as Seth had said, I'm the chief nursing officer of the largest federally qualified health center here in the state of Connecticut. We serve about 150,000 patients across the state of Connecticut. And again, most individuals, when they would get COVID-19, if it was severe enough, they would go to the hospital. Maybe they would end up in the intensive care unit. But the reality is that the effects of COVID are much more than just the effects of the virus itself. So we've had families who grandparents, parents, aunts, uncles, cousins, have been infected. We've read stories on the internet where whole families are affected. I think particularly in households where there are multiple families sort of living in the same unit, or what we call congregate housing. We've seen the virus spread very easily from unit to unit, from family member to family member. And that's been very challenging. But I think, the other effects of the virus that have been very, very real is people really adjusting to life being different and having to wear masks and, not being able to go out and do the normal things that they would do, maybe not being able to attend a large church service or to go on vacations or even to feel completely safe going to the grocery store. And that has had a huge impact for everyone, So even though they may have the virus or may not have the virus, a lot of people are affected with just depression and just feeling like life is very, very different than it was before. For all of our patient visits, we had started screening every single patient at the beginning of the pandemic for depression or just for feelings of isolation or struggling sort of at the beginning of the pandemic. And we saw that tons of individuals just felt more isolated, felt like they couldn't see their family, felt like they couldn't see their loved ones, particularly their elders, because they were concerned about spreading the virus to them. And as we know, the individuals who don't survive the virus tend to be those with, multiple comorbidities, diabetes, hypertension, asthma, coronary artery disease, and those that are elderly.
So COVID-19 is real, and it has been, wreaking a lot of havoc. And Mary can share a lot of our experiences. I believe she just tried to summarize that. The next question to you is, what are some of the fastest ways that the virus can be contacted?
So obviously the fastest way is close personal contact. They do feel that the virus is airborne. And so again, particularly when you are not wearing a mask, or if you're in the same room with close personal contact with an individual, particularly for greater than 15 minutes, and within that sort of 6-foot distance, it's really interesting because when you would read sort of on this Center for Disease Control and Prevention's website, 6 feet or 12 feet, lots of people were really just trying to figure out, what can I get away with and not get the virus? Also knowing that masks are very different. So you hear about these things called gaiters, it's sort of a piece of fabric that you pull over your head, and then you can just pull it up to act as a mask. Those have not been found to be very protective. Even our fabric masks, they definitely are better than nothing. But certainly surgical masks, or of course N95s, do tend to be better. But of course, those are not in wide variety or widely available to the general public. People made a lot of different kinds of masks. They would put coffee filters in them or other types of filters to try to keep that, but to keep the spread from that. So I think that the 3 biggest things that you need to do to prevent from getting the virus really are, first of all, really good hand hygiene. Don't touch your face after you touch surfaces, after you touch other people, or any of those kinds of things. You want to go ahead and really do good hand hygiene. And it seems awkwardly long when you do good hand hygiene. You're really looking for 30 to 40 seconds. So I encourage everyone to, take your phone out, set a timer for 40 seconds, and actually wash your hands for that long. And you will know that you probably have not been adequately washing your hands up until this point in time. And that means, getting around where your rings are, getting in between your fingers, getting the top of your hands, like every part of your hands. Then, of course, wearing those face masks. If you're within a 6-foot distance, you actually also need eyewear too, goggles or a face shield or something, because it can also be spread into the mucous membranes of the eyes. And glasses are not protective because, again, air can get behind them. So goggles that fit to the face, or, as I said, kind of a larger face shield that fits over the face, that is what we as medical professionals wear when we are interacting with patients in an exam room, even when they remain fully masked. So being in enclosed spaces. So, if you're visiting your family outside, you're less likely to contract the virus because, again, there's good air movement. You have the ability to keep your distance. But inside of a building or inside of a room, that spread can happen much more easily.
And talking about, masks, the next question I was supposed to ask you was the prevention, which you have already covered. But talking about wearing masks, does wearing the mask without maintaining social distancing help?
Yes, but not much. You really need to do it in coordination with social distancing. So that's why they say, for example, if you both have a mask on, you can get as close as 6 feet. If one person has a mask and the other one doesn't, it should really be closer to 12 to 18 feet away that you should remain. And again, the things that promote spread more are also the length of the exposure, right? So if I'm if we were in the same room having this conversation, after an hour, that's a pretty long, a long exposure. So your likelihood of potentially getting it, should I have the virus, would be much higher. However, doing this virtually, there really is no risk. Thankfully, the internet does not spread COVID-19. But I think still, we as human beings, we crave, interaction, and, the virtual world oftentimes isn't enough for us. And so you see, even over the holiday season, we heard families saying, I don't care, I want to see my family, I miss them, I've been away from them so much. And it's very, very challenging to balance all of those things and to stay safe.
And still talking about wearing masks, is there a right way or a wrong way to wear the masks?
Oh, absolutely. Hey, Kwamina, can you pass me a mask, actually? Do you have one? Just pass me the bag. Okay, I have a whole bunch of different kind of masks here. So first I'll show you, this is what a gaiter is. So these do not help. These are not as helpful. You still see some people wear them, but they're just a piece of fabric that you can put over your face and you just pull it up. But because it fits so tightly and it's only one thin sheet of fabric, it's not very good. So the masks that I wear come like this. So
Okay.
this is a surgical mask. And you'll notice, so it has the two elastic hoops on the side. And then you'll notice the top of the mask actually has a metal piece in it right here. And then the bottom does not. And then the pleats do tend to go down. So the pleat in it, you can see them all going down. So when you're going to place it over your nose and you're just going to bend the metal to your face and then put it around your ears and then just finish fitting it so that it has a much tighter feel. So you can see here, like it touches my cheek so that not a lot of air comes out. And it's more form-fitting to the nose here. And same thing to the chin here, so less air actually leaks out. And this actually has multiple different layers of fabric in it. I have another kind of mask here. This is a similar kind of mask. It's a fabric mask that I just bought at a store, but it has a metal piece at the top, again, that fits around the nose, like so. And again, it fits tightly along the cheek here, tightly under the chin. And these fabric masks also have the ability where you can actually, at the side, you can insert a filter in here. So if you wanted to put like a coffee filter or a different type of a filter, just to make sure that the air moving in and out of the mask was more filtered, that could be helpful. Lastly, let me show you one of these too. I have to use my mouth to open it. This is actually an N95. And you can tell it's an N95 because you'll see here it says NIOSH N95. Okay. And these are manufactured in a way so that, again, they fold in half, but they're much tighter to your face. But you can see up here, like it's a multiple layers of sort of this mesh fabric. So again, the air that you breathe in and out is getting filtered by the actual material of the mask. So for these types of a mask, you open the mask, so it's like a cup, and then you're going to place it over your face, and then you put on the top elastic just above your ears, and then you'll do the bottom elastic, which will go all the way down under your hair and around to the neck. And then again, you'll actually press this metal here. And like I said before, so all of this, it's tight against my cheek, tight against the bottom, tight against the top. And you can do what we call a positive pressure check, which actually checks the seal of the mask. Because again, the way that it protects you the most is if it actually is sealed to your face, so that way very little air leaks out or leaks in. So to do a positive pressure test, you're going to just breathe out for about 5 seconds. So you'll go, and then you'll just see if you feel leakage of air around the mask. And as long as you don't feel leakage, then you have a good seal. And again, you know, even with a sealed mask of an N95, air still moves in and out of the mask. But again, the type of material protects you more. So for example, if I were going on an airplane, this is probably the type of mask that I would want, depending upon how long the air flight was. These are the type of masks, my employees wear at work, particularly when we're doing COVID testing, and things like that.
Wow. That is quite enlightening, because it is one thing for you to have the marks, it is another thing for you to know how to wear the marks.
Right,
and I
right.
guess some people, have the marks, they wear the marks, it only covers
below their
mouth.
nose.
They leave their nose, and I am wondering whether that is effective based on what you have demonstrated.
Yeah, absolutely not. Your nose and your mouth has to be inside of the mask. And I think sometimes, like for example, if you have a mask that's too big for you, sometimes it just falls down. And so you'll see people like this. But again, you can do many things with these ear loops. You can cross them, and then put it around your ear, which will tighten up the mask over your face. So if you find that your mask just doesn't really fit well, you want to make sure that you test these out. Some people too, the elastics hurt their ears. And so there's a lot of different ways you can, create like a headband and put buttons on it. And I've seen people, they just attach these to the buttons so it's not attached to your ear. So there's lots of ways that, people have sort of gotten around, how can I wear this mask and wear it the most comfortable way possible, not only to protect me, but to protect my neighbor and my family.
A moment ago, you talked about the possibility of the virus going into your eyes. What do we do with the eyes?
Yeah, so that's why, with eyes, a lot of people, what we say is, again, it's only if you're going to be extremely close with a patient that you need to, or another person, that you're going to need that kind of level of protection. Okay. You can simply buy, goggles. You can buy them in, Home Depot or like a construction store. They have different types of glasses that have side flaps on them that protect kind of around the eye. And again, you can, there are simple face shields that, basically are made of just a piece of plastic that's attached to an elastic that goes around your head.
And still, talking about COVID-19, as you know, the spread of the pandemic has been relatively slow in Africa. There have been all kinds of speculations, I would say, about why this is so. What have been the scientists, or what have the scientists been able to find out in this regard?
Well, I mean, there's a lot of things that cause viruses to spread. And of course, every virus spreads in a different way. There are other viruses that spread very easily, in Africa, and other ones, that maybe haven't. COVID-19 very much as an airborne illness, the reason why it spread so easily was really mostly based on air travel. So again, I think just the quantity of flights going in and out of the United States, in and out of Europe, is a much higher quantity than those flights going in and out of Africa. There certainly are, lots of people do fly there, but, not nearly as much as, in the States or in Europe or in other places. And so again, and it's not so much air travel itself, because within the airplane, there actually is pretty good air exchange. There was a study done out of Harvard, the Harvard School of Public Health, that really found that, it was actually riskier to go to the grocery store than it was to actually be on an airplane with COVID-19. The challenge is, though, is that now, of course, being on an airplane, because the airlines have lost a lot of money of people not feeling safe to travel, they are now, beginning to put more people on the plane. And so the closer you are to other people for a longer period of time, the higher your risk is to transmit the virus. So, but there actually is, there's some new stuff. You guys have you probably read it coming out of South Africa. There's actually a new variant that they're expecting. It will still take a little bit longer to come to the US. Again, just mainly because there isn't as much travel. The UK variant is alive and well here in the United States, unfortunately. But the South Africa variant, they know will eventually get here, but it will take a little bit longer, they think so.
Yeah, so there are two follow-up questions based on what you just said. I'll start with the first one. I'll talk about the variant after this question, but still talking about why the spread of COVID-19 is relatively it's not as widespread in Africa. Some people have said maybe it has something to do with the weather or the climate. Is this something that you have come across?
I think that's hard to tell. There was a lot of theories that even here in the United States that, as soon as spring or summer came, that we would see COVID-19 sort of decrease and then would start to see another increase coming in the fall. But I'm sure if you take a look at the data, I mean, COVID-19 was pretty much strong all the way through. So I don't know that we really think that the evidence is there that that weather necessarily affects it. I mean, I guess what I would say is just sort of what I had said before is that when you're with other individuals outside, your risk is definitely lower with transmission than if you are inside. Obviously outside you can spread yourself out more. There's better airflow and things like that. But again, a lot of folks said, we'll see our rates go down over the summer, and we just did not experience that.
And talk to me a little bit about this variant that we are hearing about. Is it like, are there different kinds of variants? You just mentioned, a variant in South Africa. Will that be different from the variant that we are finding out in the United States and Europe? Or what is it all variant about?
Yeah, so the variants, they are different. So right now we have the UK variant. There's the variant in South Africa. And I feel like there's one more, and I forget where it is, somewhere in Asia, I think. But really what the variant is if you think about viruses, they are very, very hardy. And just as we begin to learn how to fight them, they also learn and evolve and, begin to be stronger. So again, they find ways of changing or mutating over time. And so sometimes the ways that we combat them are not as effective over time. The good news is that they really, at least right now, feel as if the evidence behind the two vaccines that are out on the market, the Pfizer vaccine and the Moderna vaccine, that both of them will still be effective against the UK variant as well as against the South African variant. The UK variant is definitely one that's very, very concerning. A lot of the evidence has really shown that it is actually even more transmissible than the first version of the coronavirus, and they're finding that it's highly, highly contagious. So that's why, again, even here in Connecticut, where we are, we've actually had our first cases, already diagnosed here in the state of Connecticut with the UK variant.
Wow. So the good news is that we'll be talking about a little bit about the vaccine. Maybe I should reserve that when we get there.
Sure.
So the next question, I guess, is when it all started, I remember that there were rumors circulating on social media that Black people are resistant to the virus. But we quickly found out after a couple of months that Black people were actually the ones who were mostly impacted here in the United States because of socio-economic factors that are
Absolutely.
so what can Africans learn from this, especially if someone is listening to this from Africa, say Nigeria, and they still feel that, they are still thinking, using this myth or believing this myth that Black people are resistant to the virus? How will you advise them?
Yeah, I mean, first I would just say the virus does not discriminate. We are all human beings, and the virus will go after anyone. And I think here in the United States, unfortunately, what we experience, though, is that those that experience health inequities, or who don't necessarily, there's a significant amount of racial inequities and health disparities that we see. If I were to go, want a certain appointment with a provider, it might be easier for me to do that just based on the color of my skin. So depending upon how your systems in Africa are set up, again, there may be different groups that, experience racial inequities, or whether it's tribal or other things. And again, those health disparities can absolutely lead to poorer outcomes for those particular individuals. And that's what we're seeing, is that, care is not the same across all races, across all socioeconomic statuses. There are people here, who have insurance and those who don't have insurance and those who don't have very great insurance. So, it's all on a spectrum. And unfortunately, those things sometimes can make the difference between life or death. When our ex-president, got COVID-19, he had the very best treatments available to him. Most of, our insurances won't pay for that type of treatment. And that is, in my mind, I feel like, healthcare is a fundamental human right. It's not a privilege that should be reserved for a very few, but it's something that everyone should have access to.
Still talking about, COVID-19, I want us to talk a little bit about the vaccination or the vaccine. There have been widespread conspiracies, I would say, or conspiracy theories about the vaccine. Some say that the vaccine is meant to reduce the population of a certain race or certain races in the world, and all sorts of other unscientific speculations of that nature. So my first question to you in this regard is, do the vaccines actually work? And if they do, why should people trust them and debunk the rumors about population reduction? I'm very sure that you are familiar with all these conspiracy theories about, the vaccine is targeting a certain race and what have you. I wanted to speak a little bit about that.
Yeah. Well, I think in general, conspiracy theories about vaccines are certainly, we are not new to them. So it's not just the COVID-19 vaccine, but several other vaccines have a lot of rumors and theories and many statements that have been debunked by science over the years. I think for the COVID-19 vaccine specifically, a lot of people were really struggling, for example, with how quickly, they felt like it was so quick. How the vaccines got approved and then were available to the public. So a lot of people just didn't trust them related to that. But the reality is that if you go to the World Health Organization website, they actually do have it's a lengthy document, but they do have a grid of sort of every vaccine candidate for COVID-19 that is either in the process of being developed or has made it to the various different phases of trials. And again, both for Pfizer and Moderna, the phase 3 trials, they involved thousands of people. I think Pfizer, it was 15,000 in each arm or something more than that, and about the same for Moderna as well. So again, when you're studying that large an amount of people, you really are able to see kind of the evidence and what people experience over, once they get the actual vaccine. So I think vaccines, we know, have saved lives, all kinds of lives for all different kinds of, curable illnesses and things that, used to be a problem, but then, we never really see them much anymore, right? We don't really see polio in the United States anymore. Measles, every once in a while, when you come across a large group of individuals who isn't vaccinated, sometimes we'll see that. And other illnesses. Even in Africa, I know when I come to visit, I have to, bring my yellow fever card and prove that I'm vaccinated for that and vaccinated for typhoid and some of these other things that, used to be a lot more common, than they are now. So for the COVID-19 vaccine, I think, it came to market quickly. So there is still some information that we don't know about it. For example, one of the main things that we don't know is how long the protection will last. So we do know, for example, with Pfizer, it's about 95.6% or 96.2%. It's up there. And for Moderna, it's about 94.6% protection for the average patient who's being, given that vaccine. People still may get COVID-19 when they get the vaccine, but it's likely to be a less less powerful version of the virus. So you still may feel sick, but it may reduce your likelihood of actually dying from the virus. I myself actually just got my second Moderna vaccine yesterday. And when you read the studies for Moderna too, I mean, the side effect profile is pretty high. When I give education to individuals, I'm always saying, you have to wait 15 minutes after your vaccine because we're looking for an adverse reaction, which could be, swelling of the face or throat, shortness of breath, dizziness, a body rash over your whole body, heart palpitations. But your other more limited side effects that you could have is a site, pain or redness or swelling at the site of the injection. You can have pain, swelling, or tenderness of the lymph nodes kind of under the arm where you get the vaccine, joint pain, muscle pain, headache, nausea, vomiting, fever. I mean, it's a pretty lengthy list. Site pain, for example, with the Moderna vaccine, it's like 92% of people experience that. I will say it wasn't as bad as my tetanus shot, my last tetanus vaccine. But today, for example, after the second one, they say your second one, you do tend to have a more powerful reaction. And I did. I woke up with a lot of muscle pain and joint pain. But I also know that that's my immune system responding and actually building those antibodies. And so just me personally getting to see, thousands of people here in the state of Connecticut and seeing them vaccinated. I've held the vials in my hand, both of Pfizer and Moderna vaccines. We actually give both of them at our clinics, and we are giving them to the most vulnerable patients. What I worry about with the vaccine is that it's not going to get to the right people. So although there may be conspiracies that, maybe it is, for population control or to affect certain groups, the reality is that I'm worried that may get in the way of some of our most vulnerable groups actually getting the vaccine when they're the ones who need it the most.
One of the lines of argument by the so-called conspiracy theorists is that HIV has been here for decades. We don't have vaccine for it. Malaria has been there for decades, and typhoid and some of these, sicknesses, especially in Africa, that have been killing thousands of people over a long period. Why don't we have vaccines for all these sicknesses that are really deadly? But all of a sudden, COVID-19 is here. Within the period of 1 year or less, we have vaccine for that. How will you, as a medical professional, how would you respond to that kind of argument?
Well, I mean, not every virus is the same, right? Coronavirus or COVID-19 is a type of a coronavirus, right? HIV is an enveloped virus. They look very different. They act very different. The way that they are transmitted is very different. For example, HIV is transmitted through blood and bodily fluids, whereas, as I said, coronavirus is an airborne illness. So again, the main treatment for the spread of HIV is to actually work on the public health things to prevent the spread, whether it's sharing of needles or spreading through, sexual intercourse or through, there was a period of time where blood transfusions, right? Blood was not, blood at the blood banks or at hospitals was not being screened, and so over time, those things have gotten better. We're actually here in the United States very thrilled. The first injection that we have for HIV, for a combination of medications put together to treat HIV. I mean, we are in the age where people are not dying of HIV here in the United States. They are dying of other things. They're living longer lives, happier lives. And I think the challenge is, right, is that those treatments need to get to Africa. They need to be available to every individual who struggles with HIV, or contracted HIV. In any way, shape, or form. There's actually a number of groups working in Africa. Even one of my, main colleagues, Dr. Marwan Haddad, he actually did some work in Uganda, through PEPFAR and a few others to really talk about how they could get those treatments. Because again, there's a lot of stigma still, even here in the United States, there's still a stigma with HIV, who is affected and how. But there are treatments for all of these things and ways to prevent them. But not every virus is really ripe for a vaccine. That's the issue.
And talk to me, still talking about, the vaccine. You previously mentioned there are at least 2 approved versions of the vaccines right now, circulating in the United States and other parts of the world. We're talking about Pfizer and also Moderna.
Mhm.
Does it matter which one of them one receives? You previously said that I think Moderna. Sorry, I'm calling something different. Moderna,
No, that's
right?
okay. Moderna, you got it.
It has like 94%, prevention, while Pfizer has is it 95?
It's like 95. It might be like 1% more.
So in
I
other
don't,
words,
yeah, I don't think it really matters. I don't think it really matters. I think whatever vaccine you have access to, I advise you to take it. I had access to Moderna first, and I said I want to get vaccinated. I'm working with patients who come in with COVID-19. We are treating the community. I also, firmly believe that we as healthcare professionals need to lead by example, right? The fact that I've gotten both of my vaccines and that I feel completely comfortable and confident to do that says something to my patients, right? When my patients ask me, so Mary, did you get the vaccine? I can say yes, absolutely, and this was my experience. So again, the goal is really to support and to comfort, those who are considering, should I get the vaccine? Should I not get the vaccine? A few minor differences between the two vaccines, though, that should be kept in mind is that the Pfizer vaccine is actually approved for 16 years of age and older, whereas the Moderna vaccine is only approved for 18 years of age and older. I have heard that Pfizer is going for an indication, so they're applying for an indication for age 12 and above. So for people who have young teenagers who really want to have access to the vaccine, hopefully that will be coming. And again, for most vaccines, the reason why it does take a lot longer to come to market is because they do research on the pediatric population or do longer studies to find out how long the protection lasts. And so we don't have that information right now. So what the FDA did, or the Food and Drug Administration did, is they gave it emergency use authorization, which basically said, the study is there for people 18 years of age and older. We know that getting 2 doses, for Pfizer, it's 21 days apart. For Moderna, it's 28 days apart. Does give you that effective prevention of the COVID-19 virus. However, again, they don't know how long it lasts. With a flu vaccine, we have to take it every single year. So, it may, once the longer studies are done, we may find out that we need to get a booster to our COVID-19 vaccine another year from now. Those are the studies that are now ongoing, that they're continuing to look at and continuing to collect data with.
So if I'm given a choice between Pfizer and Moderna, does it matter?
I would say no.
Okay, it doesn't. All right.
I will say the Pfizer vaccine is a smaller dose. It's 0.3 milliliters instead of 0.5. And the needles, even though they're all 1-inch needles, it's a smaller syringe. So
okay.
I don't know if that really matters. Pfizer did have slightly less side effects in terms of tenderness around the site. So, but again, I wouldn't say that either one is better at protecting against coronavirus than others.
Aside from these two, Pfizer and Moderna, do we have other approved, at least by the standards of World Health Organization, other approved vaccines anywhere in the world?
Not yet. There are more that are going to be coming to market. Like right now, for example, AstraZeneca has one that's coming about. They're still doing some studies on it, though, because they did have, one patient that had a pretty severe reaction, so they had to halt the study. And then they had to try to figure out, was that related to the vaccine or related to something else before they could continue on with the study. And then the other one is Johnson & Johnson. Those are the other two kind of big candidates. The one main difference with the Johnson & Johnson vaccine is it's a single dose. Which is nice, whereas the other ones you do have to come back for a second dose. And I think a lot of people just have concerns and fears that once you get the first dose, they may not necessarily have enough vaccine to get the second dose. And so people are worried that, we might run out. And I will say, we get our COVID-19 vaccines on a week-to-week basis, and we can vaccinate a lot more people than we have vaccine for sure. So again, that's why I say, if you have the opportunity to get vaccinated, absolutely take it.
How long do I have to wait after the first dose?
So for Pfizer, it's 3 weeks, and for Moderna, it's 4 weeks.
Okay.
Yeah. The other difference too between the Pfizer and Moderna vaccine specifically is storage and handling. And so we find a lot of clinics are more likely to take the Moderna vaccine because you can actually store it at regular freezer temperatures like you normally would your other frozen vaccines. But the Pfizer vaccine is actually stored in an ultra cold freezer. So for those of you, I have to like check for what Celsius is, but Fahrenheit, I know off the top of my head, it's the low is negative 112 degrees and the high is negative 76 degrees. So the Pfizer vaccine has to be held very, very, very cold temperatures. So when we receive our shipments of the Pfizer vaccine, I have 5 minutes or less to unpack the box, get everything out, and put it in the ultra cold freezer before I could potentially damage those vaccines.
And I think that also raises the question, especially in Africa, in some of these other places that don't have steady power supply, how will that impact the vaccine?
Absolutely. And that is certainly something that I'm very, very concerned about because I've seen even just here in the United States, when you read articles about vaccines that have been spoiled because they haven't been, stored at the appropriate temperature, like hundreds of doses that had to just be thrown away because these vaccines don't have preservatives in them. And to think about how are you going to do that into the ruralist, village or the ruralist place in Africa. And as you said, where, power outages and other things, definitely affect, what's happening there. How, is it going to require people traveling to a main city, or are they actually going to be able to get this out to the smaller towns and cities? And I think that's going to be the big challenge. Certainly, I don't think it's going to be the Pfizer vaccine. And even the Moderna vaccine, it's still, has to be held between negative 14 and negative 5 or plus 5 actually.
And so this is becoming a little bit complicated. So another question I have regarding the vaccine and especially the storage is, when you say you can't use it because it is spoiled, what do you mean by that? Is it that there is something that you see physically or just by the timing? Because I'm also concerned that in some places, for instance, like Africa, when you have cases like this, that it is not it is not handled within the 5 minutes that stipulated time that is given. People may still be injected with these vaccines that are not effective. And don't you think that will be dangerous?
Yeah, I mean, people won't necessarily be harmed by them, but they're not going to have as robust an immune response, right? Which means, they may not have the protection against the coronavirus that they thought they would. In the package inserts for all the vaccines, they have really detailed instructions. When you inspect the vaccine, what are the things that you're looking for? They describe, the color. For example, the Moderna vaccine is sort of an opaque white. It's not fully white. It's still sort of clear to white. But you're looking to see, are there any particles in it? Is there condensation in the vial? If any of those things happen, then it may not be a viable vaccine. So you may inject it into a person, but again, their immune system may not respond, which means they don't get the protection that they need, for the virus. And those things that's definitely a huge concern of mine. And as I said, here in the United States, we've had a number of issues, just different articles that I've read across the country of vaccines being spoiled. And again, a lot of it isn't just about the main storage, but so let's talk about the Moderna vaccine, for example, because that's easier than Pfizer. When you take it out of the freezer and you put it in the refrigerator, it's good in the refrigerator for 30 days. So you can use those doses up within that 30 days. But also, as soon as you puncture the vial, and in each vial is 10 doses. So as soon as you puncture the vial, though, the vial is only good for 6 hours. So once you start drawing up vaccine, you have to make sure that you have 10 people that you're going to vaccinate, within those 6 hours, or again, those doses may no longer be viable.
Another concern I have is, since especially most of the vaccines that are accessible right now, you have to take 2 doses, right, to have up the immunity.
Yep.
My question is, what if in a situation where I take the first dose, but I don't get the second one? What happens? Do I have some kind of partial protection, or what is the scenario like?
Yeah, your protection just isn't as good. If you read the studies will say that, after dose 1, you maybe get like, 46% protection or somewhere in that realm, but it's 2 weeks after the second dose that you can achieve up to that 94.6% protection. So again, it really is, it's very, very important that you make plans. And even for our patients, we'll talk to them. Are you going to be able to come back and get your second dose? Again, the way that they're organizing the vaccines too is they're trying to reserve the second doses. So if I give you a first dose, then I will be given a second dose to give to you to make sure that everybody will be able to receive their second dose on time. But it's very, very cumbersome to really sort of manage that process. They have sort of a national system that the CDC put together that where a lot of us are using to document those doses because, people move around, they move from state to state. Maybe they get their first dose while they're here in Connecticut, but 3 weeks later they move to, DC or, Baltimore or something. And they need to be able to schedule their appointment for their second dose down there. But it's just very, very challenging though to make sure that everybody gets it on time. And really one of the articles I was reading this morning, it was talking about getting to herd immunity, which what herd immunity is it's sort of if enough people around you were protected against the virus, you would start to see virus rates go down. And even if you are not vaccinated, you could gain some protection because of all the people around you that are vaccinated. I mean, and we're looking at having to get to, rates of about 80% or higher to really achieve good herd immunity. I mean, for lots of other vaccines, it's, they'll show 90% as being the threshold. So, anytime you dip below, for example, like with measles, you dip below 90%, you have risk of actually seeing measles cases because there's not enough people who are vaccinated to prevent that for the folks who maybe couldn't get vaccinated.
And talking about the 2 doses of the vaccine, is there anything different? Is the first dose different from the second dose, or is the same thing just administered twice?
It's the same thing administered twice, but I will say just from my own experience, the side effects were very different for me. Dose 1, I had pain around the injection site, and then I felt a little bit nauseous the next morning. After I had breakfast, I felt fine. But this one really, it was quite impressive. Just when I woke up this morning, I had a fever, and like I said, my joints ached, my muscles ached. Parts of me that I haven't felt in years, ached. And that was definitely very challenging, for me. And to even think that if that is a small amount of what having COVID-19 feels like, then I don't ever want it. Because, again, I feel much better now, but, I woke up this way this morning and I just thought, wow, this is pretty profound, how I feel. So I think they are saying that with the Moderna dose, maybe not so much quite with Pfizer, but that your first dose, certainly you have an immune response, but with your second one, you have a boosted immune response. And so you tend to feel more side effects.
Talk to me a little bit about people that are described as asymptomatic. I don't know whether I got that word rightly. What does that actually mean? Does it mean that there are certain people, does it have to do with blood group or something that makes some people resistant to the virus?
Yeah, you don't really know what it is that causes people to be asymptomatic, but basically what it means is that you have the virus, but you're not feeling any symptoms of the virus.
Oh, so you can have the virus.
Mm-hmm.
Oh.
Yeah. So for people who are asymptomatic, they feel totally fine. And so they were like, and we've found this out a lot, when they're doing contact tracing. So whenever there's a positive case that's reported, the laboratory who did the test actually sends into the Department of Public Health for that state that, they've had a positive case. And then they do what they call a contact investigation to really try to figure out how did this person get COVID-19. And what they find, even, in my home state of Maine, they traced one back to like a wedding where, tons of people just felt totally fine. But, afterwards, there was, 15 or so people who passed away from COVID-19 because they got it at that big event. So what should be a joyous occasion to remember is really not anymore. And I think, those are the types of things that are really, really challenging.
So still talking about asymptomatic people that can have the virus and not feel anything sick or anything like that, but can they pass it on to other people?
They absolutely can. And that was, over the summertime, that was a lot of what we were hearing in the media is how a lot of younger people would get it and they would feel just totally fine. And so they would go out, they would visit their grandparents, and then they would get them sick. And then, they, as, a 20-something-year-old would survive it just fine because they were young and, didn't have any chronic illnesses. But then like their grandparents would die because they were older, had more chronic illnesses and other problems. So that definitely has been a challenge. The other thing too is that some people weren't necessarily asymptomatic, but they might have had 1 or 2 days where they just had a small amount of symptoms, but they thought it was a cold, and so they just passed it off. And, maybe they randomly decided to get a test and all of a sudden it was positive. Because the other thing we note too is that, typically, so once you get COVID-19, the isolation period afterwards is 10 days, either from the date of the test, if you're asymptomatic, or if you have symptoms, it's 10 days from the date of your first symptom. So again, they might have had 2 days of symptoms, thought it was nothing. But the other thing is even once they're beyond their isolation, they can still test positive for months. So you aren't contagious then, but if you were to be tested, your test would still show that you're positive because you have dead virus in your nasopharynx that can be picked up on swab.
And still talking about this because it's something that I'm not a medical professional, but it's something that I've been concerned about, these asymptomatic people. Do we know something about them, like some features or characteristics about them that make them that way? For instance, I want you to talk to me a little bit about children. Why is it that most kids, I think it has been scientifically proven that most kids don't get the virus. So does this have to do, talking about people that are asymptomatic, does it have to do with age, or it is something different?
Yeah. A lot of it, kids do absolutely get the virus, but they recover from it more easily is the issue. So, and they're more likely to be asymptomatic, but there certainly have been children who have died from the virus too. Again, those that are chronically ill or have, certain types of medical conditions. They haven't really found the thread as to, is there a particular thing about the person, like you said before, their blood type or other things that makes them less at risk. I think if they knew, they would be trying to figure out how to make it that way for all of us. But they haven't really been able to figure that out. And that's why, focusing on the public health interventions like washing your hands and socially distancing and wearing your masks and all of those things have really continued to be supportive. And again, some people are willing to do those things to protect their neighbors and others are just not.
What are the basic symptoms of COVID-19?
It can actually vary. And, back even at the beginning of the virus, I think we had a list of about 7, and then it grew to like a list of about 12 or 15 different side effects or symptoms that you may feel from the virus. But, it's headache, fever, chills, cough, runny nose, loss of sense of taste or smell. Some people, that was the only symptom that they got, is all of a sudden they ate their dinner and they realized that the food tasted really bland when they know it should taste good. And, they'd get themselves a COVID test and they were positive. Body aches, joint pain, headaches, all of that, so definitely, very, very exhausting. The other thing about COVID-19 though is that also there is this sort of, rebounding of the virus. So many people, when they would first start to get sick in the first few days, they would start to feel like they were improving. And then sometime between day 5 and 10, they would just get much, much worse. And so some patients who were fine outside of the hospital, all of a sudden come day 8, they just felt like they couldn't breathe and they'd have to go into the hospital. And some patients, much like my husband's patient, they were intubated. They had a tube to help them to breathe. Because they could not do it on their own.
Even as we try to wrap it up, what is your advice to places like Africa that, at least for now, have been less impacted by the pandemic?
I think the best advice is to just be ready. Just because you haven't been impacted yet doesn't mean that the virus won't all of a sudden come there and begin to proliferate. And so, good hand hygiene won't just protect you from coronavirus, but it'll protect you from a lot of other things. So really making sure you're washing your hands, using an alcohol-based rub on your hands will help. Making sure that again, when people are sick or having symptoms, that you stay away from them, right? You can bring your neighbor some soup, you can bring them some food or bring them something else, but don't spend a lot of time right at their bedside where you yourself could get sick. Make masks. I think, there's lots of different fabrics and other things that could be used to actually make masks to be prepared should COVID-19 actually become much more robust where you are. And then I think, if the vaccine does become available to you, go ahead and take the vaccine. I think the more people who are vaccinated, the better off we're going to be. And again, I think there's a lot of concern that the virus may mutate. And if it does, that there may come a point that these vaccines are no longer going to work. But I think the sooner we all get vaccinated, the sooner we can try to get the rates of this virus to go down, the sooner we're going to start to see, not that things will return to normal, but that, we will be able to have much more contact with each other. And the reality is we know that that's what we need, right? Human beings were made to interact and to be in relationship. And, we have been very challenged as humans, I think, to figure out how to be in relationship and how to interact with each other during the course of this virus. We've had to deal with a lot of different feelings and, missed out on a lot of the hugs or other kinds of physical touch or social support that we've gotten from people that we love and care about. Even I know for me and, Seth, I used to love to hear you preach and watch you preach like 12 feet from me, and now I actually go to a few different church services that I Zoom into, one in the state of Alabama, one in, other places. And, but it's, there are things about that I love because I don't have to go to those places. But at the same token, I do miss that contact.
Yeah, talking about contact and churches specifically, and I will say religious organizations. What is this will be my last question. What is your advice to churches and mosques and religious organizations that are still gathering in their thousands, especially in Africa, while wearing the masks? And not maintaining social distance.
Well, I believe that God is a scientist. I believe he created science. And so in my head, I just, I understand, that of course he wants us to gather and he wants us to be in community with each other, but I know he wants us to be safe as well and to support, our brothers and sisters to live long, healthy lives, doing his work. And so sometimes that means, really making some tough decisions. So I think that churches can be very creative in the ways that they get individuals together or, doing outside services, making sure that chairs are distanced, taking, advantage of virtual platforms and, other types of things to be able to interact, with their parishioners. I just think it takes a lot of that effort. And I really do think that churches should really be supporting their congregations to know and understand that your actions affect other people. So if you have COVID-19 and you are not isolating yourself, you are potentially putting somebody else at risk for a death sentence. And, that should not be something that you take lightly. Our job is to protect and to serve and to support our neighbors and to love them, not to get them sick and have them potentially have to manage a life-threatening virus. And sometimes that's hard, right? Because we are also selfish creatures. So I think we have to fight against a lot of that selfishness to say, as much as I hate wearing this mask, and I do, like, you can ask my husband, I complain about it a lot because there are literally whole days at work where I wear this for, 9-10 hours. And, when I finally get to take it off, I want to like rub my face because it just irritates it so much. But, I do that to keep my patients safe and to keep myself safe and my family safe.
That's comforting to know, because for me, even just, I kind of try to wear it for 1 hour. I mean, it's just very uncomfortable. So it's comforting to hear, not in a positive way, but at least to hear a medical professional saying,
right, we struggle with it too, but we know we have to do it. So, and I've tried a lot of different things of, what works and what doesn't work to make you feel more comfortable with it on. Putting a little Vaseline here so that it doesn't rub as much really helps, and different things like that. But I think ultimately at the end of the day, just knowing that simple act is protecting other people and also protecting myself and my family, that's, enough for me to make it worth my while to do that.
What a wonderful way to wrap it up. Wearing the mask, washing your hands, and, maintaining social distance, and all those things can be encapsulated under loving your neighbor and caring for your neighbor. And I feel if we think of it that way, it doesn't matter whether you feel sick or whether you have been diagnosed with it or not. If you just think about being a responsible citizen, caring for your neighbor means that you should social distance so that you are protecting them. And I think it will change the way we approach this. Dr. Blankson, thank you so much for your time. It's been a wonderful time to just talk about COVID-19, and thank you for all the free educational information you have given us about this. I really appreciate your time.
Oh, not a problem. Definitely supporting anybody to make good decisions and to hopefully not get COVID-19, I think is super, super important. And when and if the vaccine, gets to a country or city or town near you, hopefully they will learn from a lot of the work that we're doing, all over the place right now to set up mass vaccination in places. I know one of the clinics, that we just set up there, we will have a press conference there tomorrow. We're doing anywhere from, we did 1,200 people just on Friday alone giving vaccines. So right now we're focusing on age 75 and above, but very soon, that will move to 65 and above, and then to those with chronic illnesses. So just, I definitely encourage everyone to keep your eyes and ears open. And when and if it becomes your turn or your opportunity to be able to get the vaccine, please take us up on that and keep yourself safe.
Once again, thank you so much. I know you are very, very busy. Your hands are full, but you decided to do this because you know that this is also part of caring for your neighbors. Somebody is going to benefit from this. So once again, thank you so much. For all of you that, watch this program, I hope that you have benefited in one way or another. And I thank you so much for following. Until I come your way next time with another interesting episode of The Interview. Bye for now.
Bye.